Hey everybody, this is Jeff from TDC bringing you this week's 2-minute policy video. I am a white male with dark graying hair pulled back. I'm wearing a blue shirt and white sweater, and I'm standing in front of a coalition blue screen. Today, we're going to nerd out. Let's talk about a bill that, on its face, might not seem like it accomplishes much, but if you look a little farther down the line, you can see that it could be incredibly impactful. The bill is titled the TennCare Network Reporting Reform Act, and it's sponsored by Representative Michael Hale and Senator Becky Massey. TennCare and their contracted MCOs, like Blue Cross Blue Shield and United Healthcare, are required by the federal government to maintain an adequate network of providers. Providers are often doctors or other healthcare specialists, but in the Medicaid system, they also include DSP agencies, therapists, job coaches, and the like. To prove that they're maintaining an adequate network, they have to send CMS a big, complicated report that describes network adequacy in terms of time and distance, among a couple other things. But what does that mean? A network is considered adequate if there exists a provider within a certain time and distance of a Medicaid enrollee. For example, a primary care network might be considered hunky-dory if an MCO contracts with a primary care provider that's within 30 minutes or 30 miles of a Medicaid enrollee. TennCare normally scores very well under this standard. Doesn't matter if that PCP is not taking new Medicaid clients, has only one inactive client, or has an 18-month wait list. By time and distance standard, that network is considered adequate because Medicaid enrollees technically have access. But we know that isn't actual access. It's just the appearance of access. We think that our bill, modeled after the 2024 HCBS access rule, does a better job depicting actual access. The bill requires TennCare and the MCOs to report on network adequacy using percent service utilization, or how much of a service you promise versus what you actually get, appointment wait times, and time between approval for a service and the start of that service, on top of time and distance, or any other federally required standard. We hear daily from Tennesseans with disabilities that they cannot access providers for healthcare, long-term supports and services, and home and community-based services. We believe that by this bill's new network adequacy standards, that reality will now be reflected in the data. Not only that, the data is broken down by county, by service, by waiver program, and by demographics. That should tell us exactly who is or is not getting services, what types of services are inaccessible, and where those provider networks are failing. From there, we have enormous leverage to push TennCare and the MCOs to take steps to improve their network, and thus improve access to care, support, and services that the state has promised Tennesseans enrolled in TennCare programs. We're going to need a lot of grassroots support for this one, so stay tuned about how you can be involved in improving access to care in Tennessee. Thanks for nerding out with me. This has been Jeff. Catch you next time.